All right.
1,
2, 3, 4. Nah. 5.
6,
7.
8.
9.
10.
That's 5.
Did you know that sudden cardiac arrest is one of the leading causes of death, with nearly 400,000 cases occurring annually in the United States? Sudden cardiac arrest is more common than you think. It can happen to anyone at any age at any time. 4 out of 5 instances of sudden cardiac arrest occur in people's homes, with 81% of those occurring in private or residential settings, according to the American Heart Association web article, CPR and Sudden Cardiac Arrest Fact Sheet. Administering CPR can be a critical life-saving effort that can literally mean the difference between life or death for someone. Today I'm going to explain the importance of the most up-to-date method in administering cardiopulmonary resuscitation. There's been a great deal of debate surrounding the topic of CPR administration for numerous reasons over time. People are reluctant to intervene in emergency situations, especially those involving a stranger. The American Heart Association interviewed people and determined that panic and fear were the 2 biggest obstacles when people needed to take the initiative to administer CPR. People said that they felt helpless because of their lack of knowledge as well as their fear of injuring their victim during CPR administration. Another topic of debate is the risk of disease transmission because of the mouth-to-mouth contact during CPR administration. While the logic is certainly understandable, it's greatly unfortunate because only 32% of victims who actually need CPR receive it by bystanders. Statistics prove that the more people who are educated about CPR, the more lives that can be saved. The American Heart Association determined that the primary issue of successful CPR administration lies in the lack of confidence by bystanders, so revisions were necessary. The 2005 guidelines required amendments to reduce or eliminate the barriers of preventing citizens from administering CPR. Unfortunately, only 41% of people who suffer from sudden cardiac arrest in their homes, work, or in public receive any assistance before emergency crews respond. The American Heart Association's efforts were aimed at increasing the quality and prevalence to improve survival rates during CPR administration. The American Heart Association revised the traditional methods of CPR and implemented what's called hands-only CPR that became effective as of 2008. The Study Science Advisory Journal by the American Heart Association determined that trained professionals who administer traditional CPR took much longer to initiate than the hands-only CPR method, but they also determined that both methods were equally effective. Most people are unaware of the new CPR technique, so I will now elaborate on how to implement it. Demonstrator, please come forward. Lay down. Hands-only CPR is a CPR method that does not require mouth-to-mouth resuscitation. It is completed in 2 simple steps intended for teens and adults who collapse suddenly, only in out-of-hospital situations. The first step is to call 911. You can do that yourself or you can instruct someone around you to do that. The second step is to take the heel of one hand and place it in the center of the chest of the victim and take your second hand and place it over the first. You then need to administer hard, fast chest compressions to the rate of about 100 beats per minute. An easy way to remember the rate of administering the chest compressions is to do it to the beat of the song Staying Alive. The American Heart Association determined that people felt more confident in administering hands-only CPR, and they also were more likely to remember it because of the association of the song. Thank you. Thank you. You need to continue the chest compressions until help arrives. As I conclude my speech, I hope you feel confidently educated about the latest method of CPR. If you administer CPR to someone who suddenly collapses due to sudden cardiac arrest you can double or even triple their chances of survival. If you see someone collapse, act fast. Helping to save a life may be easier than you think. All you need to do is remember the 2 simple steps. The first one is to call 911, and the second is to apply hard, fast chest compressions to the beat of the song, Staying Alive, pun intended. I certainly hope that you never need to use this method of CPR, but if you do, certainly don't hesitate to help.